Oh, hi. How are you guys? Let me see how this work. I am sorry. This is Dr. Lu from Generation X. I'm trying to figure out how you guys can email me comments. This is my first time, so bear with me. I love technology, but it's not easy. So hold on. Now, because last time I thought someone can wave to me, but I didn't see that. Oh, hey, oh, Vitali. So Dr. Vitali Kushner is joining us. That's great. Well, welcome to today. This is my first time doing this, so it's not easy for me and some of our previous patients who have been pregnant, people who have been not yet pregnant, getting to be pregnant. So welcome to our for my first Facebook Live. And it is a very interesting times of our human history. Right now I'm at home. I guess most of you are at home. Oh, hi, Kathy. And it's not a easy times, especially everything that we're encountering. So I am excited. Today's topic is I'm going to this whole kind of 2 months, hopefully 1 month. Hopefully we're not cooped up in here, but this 1 month we're going to hopefully do hi Alicia, hopefully do a little bit more series. Like today we're going to talk about COVID and pregnancy. I have some patients who have been pregnant 20 weeks and say, oh, Dr. Lu, can I join? I said, please join. And they are all very excited. And I would talk to you guys a little bit more about COVID-19, how that will affect you. And this whole theme about science and knowledge is really evolving on objective truth, which I'm going to explain what it is, and personal truth. Like, have you been had this experience of COVID-19? Is a whole different ballgame. And I have found this very interesting and fascinating as I was thinking about COVID-19. And I want to share some personal experience with you before I start to talk about ACOG guidelines, ASRM guidelines, which quite honestly, you can Google ACOG and say pregnancy and COVID-19, what to look for. So I'm trying to extract some of the information. ACOG is American College of OBGYN, ASRM is American Society of Reproductive Medicine. Those are the two agencies that govern the way we practice medicine, and they not just me, but all the REIs, all the OBGYNs, and what to find out. And you can read them and about how to wash hands and so forth. I know you guys can do all that, but most important is I want to extract some main points and how to think. And this is exactly what I want to bring this up is after COVID-19 or all these years of medical school education and learning is what I have discovered, and all this series of topics I'm going to talk about, diminished ovarian reserve or PGTA, which is a biopsy of the embryo. All of this are really is not what you know. What you know is not as important as how you think. Those are the very important concept as we are right now at this juncture, because there's lots of unknowns. Everyone asks me, Dr. Luke, when can I come back to cycle? Dr. Luke, when can I do the next step? There's so much unknown to this field right now that makes it really, really difficult to say Yes, you can cycle next week. Yes, you can do embryo transfer, no problem. No, we don't know. And if COVID-19 is really asymptomatic, this may be with us for a long time. How, if it's asymptomatic, why would you go, you have green great, why would I suddenly now go to the emergency room, get a COVID test, right? It doesn't make sense. So COVID-19 may be with us for a while, and then the issue is it will affect all of us. And how you think about this, and how you think about for your family, for yourself, how do you take care of your loved ones, my children, or a woman who's pregnant right now, worrying about the baby, and those are the thinking that I think is the most crucial. So let's go to the meat of this. And I think you guys can send me questions, by the way. Patients, family. Oh, everyone is saying hi to me. So I guess I have to wave back, right? Wave. Okay. I think, hold on, guys. So sorry. I think I logged in through my personal Facebook. I didn't know Gen X has Generation X of Facebook. And I think I didn't know you can go in Gen X Facebook watching, so I apologize right now. They are my patients are right now trying to log in and cannot log in. So give us a moment. I wish there's music waiting for I think it's my problem. Let me ask my IT person. His name is Derek, to try to help me out. I'm so sorry, guys. It's on my personal Facebook. Yeah, a lot more. It's all my family watching. Yay! Hey, V. Hi, Cindy. Hi, Patty. Oh, Mang Feng Yi. Hi. Oh my God. People from Hong Kong are watching. That's great. Aren't people supposed to sleep in Hong Kong? It's 1 a.m. That's fantastic. But it's all my family. But my patients are not. So guys, wait a little bit. They're trying. I think my patients are logging on, and I'm going to try to repeat some points. So I'm going to make sure that I'm not in the wrong Facebook Live. This is fun. So I can say all this and you guys are yapping on the outside. I cannot hear. That's really cool. Now, can you send me a question? Can some of you just test me and send me a question? Oh, I like see that. Yes. Oh, thank you, guys. Hey, oh, so my patient's now on. Okay, sorry. Okay, now I see the numbers increase. I didn't know how Facebook works. Just to share your personal story, Dr. Luke. Actually, this is my life. I don't want you to know I'm very boring. So when I was in medical school, I go to work at 6:30, 7 a.m. We do rounds. And then after work, I go back to the laboratory, because after school, you want to get good grades. You want to be top of the class. So I do go to research, and then I go back to the dorm. It's the Yale Medical School dorm. So there's a tunnel. I never go out. So I don't even see the sun. I don't talk to anyone. And I don't know, my receptionist is calling me, but I don't know why. Hopefully no urgency, but Dr. Nature is on my other end taking care of. And I go home, and that's at night at around 7 p.m. And my life is like this in medical school, residency, fellowship. So then obviously I have kids and family, I'm married, but my life has been very mundane. So right now, and many of my patients will know, I have not changed my routine for the last 10 years since I worked in New York City. So the morning, I start at 6 a.m., I scan my patients, I go through, and you guys see me, or most of my patients say, oh, hi, patients. Some of my patients say hi, so hi. I say patients because I don't want HIPAA violation. So I just say, hi guys. And some of my family is here. Connie, hi. Evie is there. Anyway, so I will do all this kind of scanning, seeing patients in the morning. I remember a patient long time ago would say, how are you doing? I say, Dr. Luke is doing the same thing. I go on the train, I go into the city, do I eat breakfast? Sometimes I don't even eat breakfast, but I should take care of myself. Yes, I do eat a little bit breakfast. And then I go through my whole work routine, and then at 6 p.m., I get on the train and I go home. And with the COVID attacking back in March, I got scared. So I drive to work. But I do this all the time. So I work from 7 to 7 every day. So then with the quarantine, except me going to the office, I'm still doing 7 a.m. to, oh, thank you. I got candy for my daughter. And 7 a.m. to 7 p.m. And so nothing much changed with me. And then I go home and read journals. Yay! And so it's really funny. Okay, more people signing off. Sorry, I'm kind of waiting. It's my first time. So lots of technical fun and difficulties. And I apologize, but we'll get better. Hi, guys. Oh, hi. That's great. Yay, big party. So I don't do too much. I know people go out to galleries. I have a staff member, they go out to, auction, charity. I don't know. I don't know those life. I've been very like hospital and home are the two places. So the quarantine, no quarantine has not really affected me, but I know it have affected lots of you who have lots of activities and things and so forth. But in any case, okay, now I have the audience here. Oh, now I can wave. I think I wave. Okay.
Why is it white?
Okay. My daughters keep on giving me candies. Okay.
No, Mommy.
Okay, mommy is on the live.
White.
Okay, great. And this is, and so embarrassingly, this is happening at all my medical visits at home right now. Every time I'm talking, I'm trying to situate, and this is the mommy, working mom, and I'm going to do another series later on about working mom at home. Medicine will come in with her princess dress. I'm talking to a patient about miscarriage, and it's so inappropriate. So I want to apologize to all my patients who have been interrupted by Lou Medicine. So I apologize for that. But she's cute. She's okay. Medicine. Okay. White. Okay, that's right. Good. White is good. White color is good. Candy, go eat. And 5 minutes. Peppa Pig.
But can it be red?
You can be red. Yes, here, red. You can be red. Very good. Okay, guys. I have a good audience. Yay! Okay. So I am going to thank you for signing in. This is my first time. I was explaining on family and friends and patients. That's great. I didn't know there's a Facebook Genix and Facebook Janelle Luke. So I got confused because Dr. Luke, actually, again, I was explaining how boring I am. My quarantine life is similar to my work life. I know, isn't it bad? I don't really go out to eat. I stay home. I eat my rice and food. So boring, but now Facebook is the only new thing. I love this. Okay, so today we're talking about COVID-19 and pregnancy and how does that affect us. And I was just sharing before you guys sign on at the early time where I only have 20 people sign on at that moment. I was explaining that COVID-19 is like lots of things are happening around us. It's not what you know is not as important as how you think. And this is how you think is going to be a theme throughout my whole entire series during this pandemic COVID-19 Dr. Luke tried to figure out Facebook series, whatever we call this right now. And basically I want to explain is that how you think is so important, much more important than just what you know. What you know, okay, what we know. Well, go on ACOG, like let's say my patient right now, Dr. Luke, I want to know. Very easy. There's ACOG guidelines, American College of OBGYN, as well as ASRM, American Society for Reproductive Medicine. All of them do have a COVID, do have guidelines, what to do if you're pregnant. And you can read on it, and I will extract some essence that I think is important, so then we all can share some of our thinking and ideas on like what the informations that we need to know, how do we know it, and so forth. Okay, so what are viruses? So let's talk about something more scientific and knowledge based. And over the weekend, I also learned a concept about looking at things. One is called objective truth, which is, I guess, this piece of paper. There's some red color on it. So you would say this is yellow. That's objective truth. So what is objective, right? Like, where's COVID-19 come from? Actually, no one knows right now. Isn't that interesting? But there's this is not objective truth. Or objective truth are, today the temperature is 78 degrees. That's this objective truth. Personal truth is how warm outside right now, right? Because the experience, you may not be like, I was born in Hong Kong, so I hate cold weather, and some of my staff thinks I'm crazy. I wear layers, like at work. Some of my patients even laugh at me, like, Dr. Luke, it's spring, why are you wearing like that? So that's more personal truth, because you're used to warm weather, and I'm cold, and it's cold for me, okay? So COVID-19 has lots of great data out there, and in terms of like the molecules, New York Times has a beautiful article. If some people want to, and they have great writers, so can translate science into language that people love to able to understand. So viruses are very simple concepts. It's basically RNA in a box of protein. Okay, and a group of protein, and this RNA piece is able to infect and have lots of functions in this very scary virus. All the scientists in the world are like chasing to find out what is each pieces of virus can do, and how can they impact the lungs, and how they can even invade the brain, and lots of science and research is coming out for it. So that is the virus that's affecting us, and there are lots of data. Some patients say it's asymptomatic, some people say it's not asymptomatic. We don't know. But quite honestly, if it is asymptomatic, this is going to be with us for a long time. So my today talk is how COVID-19 can affect pregnancy. And I'm going to just look at my notes and so forth. It's basically when I explain to my patient, Dr. Luke, should I get pregnant now? And how does COVID-19 will affect the baby? What will happen? So common sense, don't get COVID-19, do everything you can, no kidding. But if you somehow get COVID-19, what are the prediction and things like that? It's still actually really unknown. There are lots of data has not demonstrated that COVID-19 can pass from the mommy to the baby, because they try to sequence, like to see if there's amniotic fluid, to see if there's any virus in there. There's some cases in China where they found a baby or a newborn baby has COVID, but they didn't know, is it because of breastfeeding, because there's skin-to-skin touch after you deliver a baby, the baby goes to mommy. So there's some talks like, can COVID-19 go through the mommy's lungs to the bloodstream to the baby? So we still don't know. Okay, so the objective truth about pregnancy and COVID-19 is still hard to know. Like, does it affect the baby? If does affect the baby, how the baby grown when there's a 10-year-old child, what will happen? We don't know, right? Because COVID-19 just appeared. How do you know what will happen with the child development? So those data and those information I want, and then that sometimes created more fear, because uncertainty creates fear. Uncertainty creates things that you may not know what should I expect. And so ASRM guidelines, so many say, hey guys, don't do embryo transfer. May not be, because we don't know what can this create and what will happen. And so there's lots of unknowns still in the community, and trying to understand what can we do. So that's why don't do it. Don't get pregnant yet. And lots of my patients would say, Dr. Luke, that's unfair. I've been waiting for all these years. Why would you ask me to wait for 6 months and not have sex at home? And did the CDC give us birth control right now, telling everyone wear condoms when you're having sex? So of course not right now, right? No one has yet said that. I haven't seen that in from the president and so forth. So I basically, the advice I give to a patient is precautionary measures. And they were like, what are you talking about, Dr. Luke? Well, if there's so many unknowns right now, the best way is not to catch it, right? So common sense. This is all common sense, not personal truth. Because objective truth is so vague, like what can happen? Where is COVID-19? Can be asymptomatic? Do you have tests at home right now? Well, no, I don't have a magical test COVID-19 on myself. How do I know I don't have it? Yes, I feel great. I don't have a fever, but how do you know? So precautionary measures is the only things we can do. Then you're like, precautionary measures? I'm doing that. I'm wearing masks. I'm not going out. Great, but do you go to the supermarket? Do you go to pharmacy? Do you pick up the phone while someone calling you where you're going to grocery stores? So to me right now, the major thing for today and the Facebook is really about precautionary measures. If you're pregnant, you're not going to be non-pregnant. You're going to be pregnant, expecting, and be happy and try to expect a baby. But what can you do during this time to be safe? Well, decrease visits, like any unnecessary visits. Usually, like I see my patient every 1 week of the pregnancy. Now I see them when they're bleeding, when they're cramping, when they're in pain. And lots of OBGYN also execute that. I also talk to my OBGYN office, talk to your doctor's office. Hey, what kind of precaution measures are you doing? Do you clean your service? Do you guys have N95 masks? Do every staff have good equipment? This is a great question for all your OBGYNs. All my patients who are now watching, who are going to your OBGYN, these great questions to ask. Put them in the thinking mode. When you are going to see your OBGYN practices, you are going to press elevators if there's in the building or open doors. Remember that. Gloves, get some gloves. Dr. Luke is out in certain website or Amazon or wherever. Where can we buy some? There's always ways to buy it. Some of my colleagues told me, because now China doesn't need lots of gloves, so you can see if they have overseas and ship it overseas. If any friends, get that prepared for all your visits to come, because I don't think COVID will be gone. Let's say you're right now 10 weeks, it's not going to be gone in 2 weeks, right? It's not going to be gone when you are 25 weeks. So get thinking. You're going to need to see OBGYN. You're going to get that little scan and look as a boy or a girl, all those fun things. So ask all those questions. What are the precautionary measures that your office is taking? How do I, myself as a patient, protect myself? So those are the number one key things that you're going to do. Second thing is that I do the COVID that can affect patients is also the immune system. So one of the things I mentioned to the patient, we don't know lots of details about it, but yes, if you are having COVID and you are pregnant and a woman that's not pregnant, the COVID with pregnancy women will have can possibly be sicker than a woman who is not pregnant. Why, guys? Well, because baby is, you're pregnant, so there are pregnancy inside your uterus. So immunity is a little bit lower, usually in pregnant women, and you can get sicker. So that's very important. I personally, right now, most of my patients, because our office is half closed, and that's why I can do this Facebook. I do have one patient who was very early pregnancy, got COVID, recover, and everything's fine, thank God. And she's been updating me. But we don't know what would be outcome and so forth. But COVID also is hitting patients. My hubby is a ICU, work in the ICU. He is at the front line, so he will come home and yes, he will have to change, double. Everything has to be very, very careful, and he has to change 2 types of clothes when he goes to work, when he comes in, and he would tell me that COVID, what he has seen and witnessed, and many doctors may explain, and many other doctors are at the front line too. Thank you for all the healthcare workers who is doing this. Tell me it does hit everyone from very differently. So some women, like my patient who was early pregnancy, did get it. There's only one I have. Luckily, I don't have any other patient who told me she's working in the hospital. She got with COVID, but she had really loss of smell, which is I think is about 90%. Some data, JAMA, I think article is going to come out about that. And she did not, she was having diarrhea, also very sick, fever, chills, and then 2 days she recovered. My husband talked about a little bit older patient, talked to me that patients that are that lucky, they can go downhill. So who knows? And most of our ladies, and there was also other articles and not yet a very good objective data, but more personal data, about women and men are very differently susceptible to the disease. So that's another good thing about a pregnant patient, but still, you're pregnant, your immunity is a little bit lower, so your chances of getting COVID can be there. So it's something that we need to be very aware of, because immunity can suppress the women pregnancy. And why do people, immune system to suppress the fighting chance with the COVID? So again, that's why we try to talk about precautionary measures and try to avoid getting it, please. Now, the curve will get better. If all of us are right now at home, have time to watch me, and the park is empty, we will get better. And guess what? When we get better, we get relaxed because you guys will not be watching me. CNN may not be showing a news every day. So this coming ones, I got a question. Sorry. This coming this coming time of okay. Do you guys see comments? That lots of people are commenting about how to get gloves and masks and everything. So it's good. I didn't know. Thank you, guys. Let's contribute. Oh, thank you, Madison. Another candy. I get candy every 10 minutes. And so when people start to relax, you're going to forget that. You're not going to have time at home. And that is the all my patients who are right now pregnant, graduated from me. I just make some happy graduation phone calls today for all my patients today. Please do not forget all the precautionary measures throughout. Not fear. Proactive precautionary measures. Not fear that you cannot function. Oh, now I'm not going to see my OB/GYN. No, not that. But able to do what you need to do to make sure your chances of infection as at lowest. I got some question about what happens if you have high fever during first and last trimester. I have taken care of lots of women in my old times because I was an obstetric gynecologist in terms of delivering babies. I delivered a couple hundred babies in Boston. And high fever during the last trimester is not very good because it does affect baby's heart rate. So usually women takes lots of Tylenol, and why are you having high fever? It's not good. We don't know about how can that affect there's some talks about cerebral palsy, preterm delivery, so COVID-19, and this is also from ACOG guidelines. If you do have infection and so forth, it can result in preterm pregnancy. And preeclampsia, all the complication commit does increase its risk, because you have high fever. What happens if you have a high fever during first trimester? I don't know the outcome to the baby, actually. Most of my patients who have flu and so forth, actually after the 9 months is such a long time, the baby is different, the environment is different. So I had a patient who are very sick during the first trimester. I forgot about COVID. I'm talking about any high fever during first trimester. The baby is usually okay. The baby even I deliver when people have high fever during the last trimester because there's something called chorioamnionitis. I'm not yet practicing OB/GYN, but when you are delivering babies, you can get infection when the rupture of membrane and lots of multiple cervical check to see if the baby can fit through the vagina, the cervix, to get open. Sometimes you can get infection, and patients usually get antibiotics during delivery and is taken care of during that time, and usually baby are fine. Yes, there are data when you have high fever during delivery, and can the baby be infected? Of course, there's a little bit high risk, but that's why you're in the hospital when you're during the delivery, and doctors give you medications. Okay, what if you get pregnant while you have COVID, or even after? Getting pregnant after. Hi guys. Sorry, I have to say hi for some longer friend. Hi Justine. Hi Derek. The COVID so this is where symptomatic, asymptomatic. I just gave you some of my patients who got COVID during the first trimester, who I got her pregnant. Amazing. Is a great story one day, but that's the story, IVF story. She had multiple IVF, got pregnant with her, I think 8th or 9th IVF, I don't even know how many, and she came to me from a different center, and she's an amazing woman, and she got COVID. She's also working in the hospital, amazing, still working, and in the hospital, and she got COVID, but she did recover totally fine. She was symptomatic with COVID, but she recovered. But again, we don't know. There were about 9, I think, pregnant patients in China, in Wuhan. I also read Chinese newspaper. Yes, I do. And I got some news like on the local newspaper. I think a little bit more pregnant women was infected, but we don't have because of data collections may not be perfect. So we don't yet have all that. But I think JAMA is publishing that article. Maybe it's out already. It seems to me right now, knock on wood, not yet really big news about the baby or the mommy with the COVID. It seems like they survived fine and they just watched the baby so far. But if you guys know more, I would like to know. But I don't see yet the article fully published. Maybe the abstract to publish already, but not yet the article. I got a great question. Are you encouraging people to start cycles right now, or are you having wait? So personally, right now, my office is really half like is when you come here, you're like, oh, where's everyone? Really, there's only me and my medical assistant. It is we are doing all the precautionary measures possible. Essential visits. We are not starting cycles that are like so basically it's case by case basis. We do not encourage patient come in, let's start IVF cycles. We used to do about 100 cycles per month. Now we may do 10 or even less than that. And this is because we're trying to do the social distancing. So everyone who's call me or from social media or from patients say, Dr. Luke, I want to start. I have to ask them, why do you want to start? And then they may say, Dr. Luke, my AMH is 0.1. This is my insurance, this is my last month and Then I will start to ask, what are you, have you been practicing social distancing? Do you know there's a risk of COVID? So all this empowerment and counseling starts. So then I don't, I want you to understand the risk, and we weigh risk and benefit, right? So, and then when you come in, I'm in this like astronaut suit. I don't know, one of my patients took a picture of me yesterday. I haven't posted myself yet, but I will show you maybe later on my Instagram, but it's not fun. I mean, you may look at me like I'm in, one of my anesthesiologists said I was in Chernobyl. I guess it's the nuclear plant. She said he said I look scary. So I have a P100 mask, which is a 99.5% filter, and you will see me wear this white Tyvek suit. Look like, basically what I'm doing is protecting you and protecting myself and the staff, saying that COVID is asymptomatic, which is really funny. If it is, that means it's going to be here for us for a long time, and we don't know who has COVID or not. But we have questionnaire also to evaluate and telling, and we have a mask for you. Yes, don't take extra mask because we're running out of masks, but everyone get a mask when they come in, and gloves. Why we are open? Well, the very good essential questions, and lots of my patients, like yesterday, we have 2 patients with bleeding, sadly early miscarriage. I really don't want them to go to even OB/GYN or emergency room, so we took care of them. So if anyone or my patients there, you're like, Dr. Luke, should I go to my OB/GYN or my hospital? Obviously, I will try to have you stay away from the hospital if I can, so give us a call. It's scary. So if I was not there, me and my nurse, yay, Guani, she's also waving, then she would have to go to the hospital to get her RhoGAM shot and so forth. So sometimes I do see patients. Okay. Wow. You guys have lots of comments. I love this. I've never done this. Now I'm very good now. I mean, I'm not very good. I mean, I'm getting adjusting to, okay. IVF treatment during the pandemic. Yes. Yeah. So I answered that. Yeah. The IVF treatment is really case by case basis, and also pandemic's changing. So I feel the most dangerous is when all of us say, yay, let's cycle. That actually is the most dangerous. Right now, when I'm like controlling only 5 people at the office or 10 patients, I feel the danger actually is May and June, when our guard is likely down. And that is when I felt, so Dr. Naja and I are going to think very hard in the next couple weeks and months when we are restarting the cycles, and so hopefully the pandemic is getting better. Then we will talk about, because I think at that point it's also precautionary measures. I feel like the mask thing is going to be our new normal. Sadly, I know I'm very used to it because I'm from Hong Kong, and when I was a medical student at Yale, I went for rotation in Hong Kong right after the pandemic of SARS. So, and my uncle is a front line. I know I have lots of relatives, and my husband is the front line right now. So we are very used to changing scrubs. You have to live your life. You have to save patients. You cannot just say, oh, I'm scared and go home. So my uncle also was going through lots of that. So I got to share lots of experience with him, because at that time, SARS killed 47% of the hospital staff. like the people who attend, not the entire hospital, but lots of people die through the job during SARS. So kind of used to that. Okay. IUIs is on hold. Some questions asked. Yes, we're. Yes. No, don't get rid of any of your medications. Some patient asked. No, don't do that. Great. Yeah, don't throw away like all of our patients right now. This is now going on COVID and pregnancy. I guess it's all linked together. But basically, we are going, all my patients right now doing lots of telemedicine. We are preparing them this month, what to do, learn about insurance, lots of phone calls, waiting. I hate insurance. My patient hate insurance. My finance team hate insurance. No one like them. But they do cover, so they're good that way. They cover things, so let's be positive. And when they cover things, we always have to look at the rules, what they cover, what they not cover. So this is a great time to do it, guys. Because how do you know if someone covered your insurance? I'm like, do it. And also with the economy changing, look at the Cobra insurance. Take advantage of this time now because you don't know the benefit. Like, I think we just have to be smart. And this is how you think. It's not what you know, it's how you think becomes a very important theme throughout this entire, time that we are here. Okay. Yes, embryo transfer is on hold. I do lots of counseling. I cancel over, I think, 20 to 30 embryo transfers. Me and Dr. Nija, I think I can. So we are, if the embryos is pretty good, we are going to tell you not to transfer right now. And Dr. Luke, Dr. Najat, our Generation Things team is doing everything we can, making sure all the embryos are safe and all that, and they are pretty safe. So if you have embryo frozen at Genix, we're good, not to worry. Okay, now let me see. Thank you for all your questions. This is really cool. And our next session, have not decided yet, but we're thinking will be Thursday. Is more on which relate to fertility. Same thing. It's on sex and COVID. Talking about sex, COVID, and then next week. I know this whole time is so stressful. I was so stressed out. I felt like last 2 weeks is like 2 years for me. Questions I never asked, I start to ask. So I feel like I grew much older. Do you see white hair? I'm much older. It's just so hard. Suddenly the world has changed. I'm working at home. I become a elementary teacher, kindergarten teacher, and I think cleaning. I was cleaning too, and it was just so much. I bet you guys all sharing the same feeling. It's not easy the last 2 weeks. The whole world has changed. And then everything like exposure, driving a car, I wear my gloves. And when someone call me, I'm like, don't pick up the phone. Okay. I think we're pretty good. And yes, there are 2 websites. I'm going to post it maybe on after this in case. I hate reading off the ACOG, guidelines, ASR. I mean, they're really going through, how can COVID affect fetus? Everyone's basically I don't know. Answer is too early for researchers to know how COVID can affect fetus. Some pregnant women with COVID can have preterm birth, but it's not clear whether the preterm birth was because of COVID or because elevated temperature or infection. So again, there's lots of unclear things. So that's why I focus on precautionary measures. And final thing today I'm going to talk about before we go, and 6 feet apart and social distancing, all that are important, and keep that vigilance on hold. So how one more thing is about iPhones. Actually, not iPhones, any phones. Like you have Samsung, I don't know, any handheld device that you have, because I realized that device is very dangerous because so the other day I went to grocery shopping, and my husband called me and say, "Oh, Janelle, pick this up too." So what do you do? So I clean my car I use those 70% alcohol and clean the car, clean the handle, open the door, go in, clean the wheel, and then I have my gloves, right? And so now I'm good, right? So I feel clean, I drive, I get to the supermarket, I get out, so everything's still clean because I didn't touch anything that I didn't clean. Then once you get to the supermarket, you get a card, right? So I'm going to touch the card. Now, I didn't bring in the tissue and the 90%, but that supermarket did have 90% alcohol papers to clean my handle. And so I got that and I go. But still, it was not really cleaned by me. It was cleaned by the personnel at the supermarket. So then I start to touch oranges, like because I have gloves, so I'm safe. I touch things, I choose my whatever I need. And then someone called. So it's my partner call. So what do? You reach down, and you reach up, and you do this, and like, hey, hi, how are you? Get more cucumbers. Also, and in that moment, I realized, oh my God, my glove just touched the phone, and the phone is right against me on my cheek. So if the orange has COVID or whatever service they said can have duration of time, I have got it. Like the thoughts in my mind. So then there are many instances, not that's just one instance, example, or when you're at work, when I'm at work, or the phone, because the phone is so much information. Look like I'm doing Facebook through this phone. I'm doing anything through the phone. So the phone is very important need to be cleaned every day. But you're going to be hesitant cleaning the phone because the phone is electricity. So you're not going to put washing water on it. So I know Apple phone has, they have some revised like how to clean it. I'm going to show you guys the next one. I don't have it with me, so I don't want you guys to wait. It's a ultraviolet container that you can put the phone and sterilize it. So that's what I do, because on the phone, I don't have, my phone is here, so is talking. So, but as you may know, on the edge, there's lots of divots, there are lots of buttons. So those, I know, you're like, what? The phone? How can that be? Just things like this are so important. It's all in details. And this guard that I'm saying on today's April 7th, 2020, I don't think we should keep our guards down even we're past the peak, even we're May 7th, 2020, because it's not going to be just gone like that, as you can see in places in like Asia. So my biggest advice, as in anyone who's talking to me and asking, and is that precautionary measures, even when it's lighten up. When you feel weird that you're wearing gloves, yes, you should. I wish lots of us, what we are doing right now, we did it back in January and February when I feel weird. I was wearing masks, people watching me weirdly in the train. But that was the time. That was the time, so we can have, got this, all these things that had happened to us. So I want you all to know that. Okay. Guys, I think our session is done. So we are going to talk about sex and COVID. I know it's kind of interesting talk. And I will see you, I think, Thursday at 1 p.m.
This or this?
Green is good. Green is good.
No, that's pineapple.
Okay, great. Madison, give me a candy. 10 minutes. See, she's very accurate. 10 minutes, one candy. So I will see you guys on Thursday, and I can't wait to see you then. It was a pleasure, and I can't wait. Oh, and some other patients sign up too. Okay, guys. I will talk to you later, and stay safe. Keep on social distancing. Can't wait to see you all. Hopefully out of this nightmare soon, and but enjoy this time. I'm trying to enjoy every moment with Madison and everyone, and you guys doing Facebook. I would never get to do this if COVID never happened. See, so let's look on the bright side. Okay, talk to you later. Bye bye. Now Dr. Luke.